So, good morning, sir. My name is Kevin Salcoba. I'm your PT for today. So, before we will start, sir, may I ask for your name, age, and birth date for verification purposes only? Okay. So, may I ask why are you here in the clinic today, sir? Okay. So, what we're going to do is the PNF, which is peripheral neuromuscular facilitation. This is to improve the balance of mobility and stability through strengthening. So, um, what we're going before we'll start, sir, I'm going to take your vital signs, blood pressure, temperature, pulse rate, and respiratory rate. Assuming the vital signs have been taken and everything is within normal limits, I shall now start. So, sir, at some point, sir, I'm going to touch you, and are you all right with that? Okay. So the peripheral neuromuscular facilitation is used to improve the balance of mobility and stability through strengthening or stretching movement patterns, and this is for people with muscular weakness in coordination and joint restriction. So contraindication for this is people who are experiencing dizziness, significant pain, unstable joints, fractures, and unstable medical conditions. So now, sir, we're going to start, sir. So this is called the flexion, abduction, and internal rotation pattern on your lower extremity, sir. So I want you to be in a supine position, sir. Okay. So the patient is in supine, and I could be either in front, in front or beside the patient. So like this. So what's going to happen is that the patient leg will be placed across the midline with its knee extended and the foot internally rotated and plantar flex. So like this. And then now I'm going to tell the patient to foot up, lift your leg up and out, lift up, and then that's the go sign. So I'm going to apply resistance against that motion, and then the end position, so like this. The end position is the foot is in dorsiflexion with eversion, so the knee is in full extension, and then the hip is in full flexion with enough abduction and internal rotation. So like this. So there are two variations. The one is the knee is flexed, the one is the knee is extended. So for the flexed knee, flexion abduction, internal rotation with knee flexed. So the end position will change. So same as that, same position, patient in supine, and then the end position, instead of the knee is extended, so the knee will be flexed. So for the knee flexion abduction, internal rotation with knee extension, so the first position of the patient will be changed. I'll be beside the patient, and then the patient will be towards the end of the table, so that the knee can be the knee can be flexed. So from here, you're going to go to the same end position like this, wherein the foot is in dorsiflexion with reversion, the knee is in full extension, abduction, and internal rotation. So the next technique would be the extension, adduction, external rotation. So the patient's position is the same, supine, and I'll be beside the patient. So the starting position here is that the foot will be in dorsiflex and eversion, the knee is in full extension, the hip is in full flexion, and with abduction, and internal rotation. So my hand will be on the thighs of the patient, and my proximal hand will be in the thigh, and my distal hand will be on the foot. So now from this, I'm going to tell the patient to point your toes, push your foot down, and kick down and in. So when I say push, you push. So now I'm going to apply resistance against the motion, and then the end position is that the foot will be in plantar flexion and inversion. The knee is in full extension, the hip is in extension, and it touches the table, and adduction while maintaining external rotation. So patient's leg will be on the table like this. So there are two variations to this. The extension, adduction, external rotation with knee flex and with knee extension. So for extension, I'm going to change the patient's starting position. So for extension, with knee extension, I'm going to change the patient's starting position. So the foot is in dorsiflex with eversion, the knee is in full flexion, and the hip is in full flexion with abduction and internal rotation. So from here, knee flexed towards here, and then I'm going to tell the patient, push your foot down and kick down and in. When I say kick, I'm going to apply the resistance against the motion, and then the foot, for the end position, the foot will be in plantar flexion with inversion, and the toes are flexed. The knee is in full extension, the hip is in extension, touching the table, adduction and external rotation. So like this, same end position. So the other variation is the extension, adduction, external rotation with knee flexion. So the starting position is the same like this, but the end position is different. So for this, the foot is in dorsiflexion with eversion, the knee is in full flexion, and the hip is in full flexion with adduction and internal rotation. So I'm going to tell my patient, push your foot and toes down, push your hip down, and bend your knees as you go. So I'm going to apply resistance against the motion. So the hip is extended. The hip is extended with adduction and external rotation. However, the knee is flexed over the end of the table, and the foot is in plantar flexion with inversion. So like this, flex on the table. So the next technique will be the flexion, adduction, external rotation, same position. Now I'll be beside the patient, or I can be in front and towards the patient's affected limb. So same position, my proximal hand will be on the thigh, my distal will be on the foot. So the patient is positioned in, with its leg abducted and internally rotated, knee extended, and foot in plantar flexion and inversion. So like this. And then I'm going to tell the patient, foot up, lift your leg up and in. So when I say lift up, he will move. So now I'm going to apply resistance against the motion. So the foot is in, so for the end position, so the patient's foot will be in dorsiflexion and inversion, the knee is in full extension, the hip is in full flexion with adduction and external rotation. So you will move across this. So there are two variations with this. One is with knee flexed and one is with knee extended. So with knee flex, so same starting point here, leg abducted, internally rotated, knee extended, foot in plantar flexion and inversion. And then I'm going to tell the patient, foot up, bend your leg up and across, and then bend up. So I'm going to apply the resistance against the motion. So for the end position, the foot is in dorsiflexion with inversion, the hip and knee are in full flexion and adduction and external rotation. So like this, however the knee will be flexed. Okay, so for the next variation, this will be the flexion, adduction, external rotation with knee extension. So same position, different position. The patient will be closer to the side of the bed, and then the patient's knee will be flexed beside the table like this, and then with the hip extended and abducted and internally rotated with the foot into plantar flexion and inversion. So I'm going to tell the patient, foot up, bend your hip up and straighten your knee as you go. So I'm going to apply the resistance against the motion, and then the end position is the same. So the foot is in dorsiflexion with inversion, The hip is in full flexion, the knee is in full extension, and adduction and external rotation. So external rotation. The next technique is the extension, abduction, internal rotation. So same position, patient will be in supine, I'll be beside the patient. So I'm going to position the patient in supine with foot in dorsiflexion with inversion, knee is in full extension, hip is in full flexion, adduction and external rotation. So here, same position, proximal hand on the thigh, distal hand on the foot, like that. And then I'm going to tell the patient, point your toes, push your foot down and kick down and out. Push. So I'm going to apply the resistance against the motion. So next is the foot. This is the end position. The foot is in plantar flexion with inversion and the toes are flexed. The knees remains in full extension and the hip is extended with extended, abducted and internally rotated. So there are two variations to this. One is with the knee is extended and the other one is the knee flex. So first is for the with the knee extended. So we're going to change the first position. So the patient will be in supine with the hip and knee in full flexion with dorsiflex foot and inversion and inverted foot. So the heel is close to the buttock. So make sure that you put it near the table. So it's like this with knee extended. So first is we're going to flex the knee. So your proximal still on the thigh, distal on the foot, and then you're going to tell the patient put your foot down and kick down and out. Kick. So apply resistance to the against the motion, and the end position is the same as the first one, which is like this. Next is the extension abduction, internal rotation with knee flexion. So with this one, the starting position changes. So what's going to happen is that make sure the patient is beside the table or the bed. So the patient will be the patient's hips and knee will be in full flexion. The foot is dorsiflex and inverted, and then the heel is is close to the right buttock. So like this, off the table like this. And then for this one, I'm going to tell the patient, push your foot and toes down, push your hip down, and bend your knee as you go. So for knee flexion, so from here I'm going to move it here downward, okay, with this knee flexed. So for the leg patterns in sitting, extension, adduction with knee flexion. So the patient will be in a sitting position. I'll be in front of the patient. So the patient will be, for the first position, I'm going to position the patient with his hips flexed, abducted, internally rotated, and the foot is in dorsiflexion and is in inversion. So like this. So now I'm going to tell the patient to move downwards and in. So I'm going to apply resistance against that motion. And the end position is the hip is extended with adduction and external rotation. The knee is flexed and the foot is in plantar flexion with inversion. So like this. So for the next leg pattern in sitting is the extension abduction with knee flexion. So still the same position. Patient is in sitting position. I'll be in front of the patient. So the patient will be in short sitting with the hip and knee in full extension with foot dorsiflex and inverted. Dorsiflex and inverted like this. So I'm going to tell the patient to move the foot. Down and out. So I'm going to apply resistance against that motion. So the end position is that the hip is extended with abduction, internal rotation, the knee is flexed, the foot is in plantar flexion, with eversion, like this, downwards. So next is the next leg pattern is the flexion adduction with knee extension. So same position. So the patient will be in sitting position with the knee in flexion, hip in extension with abduction, internal rotation, and the foot into plantar flexion and eversion. So from this position, I'm going to tell the patient to straighten up your leg. I'm going to straight like that. So I'm going to apply resistance against that motion, and then the end position is that the foot is in dorsiflexion with inversion, the hip is in full extension, the hip is in full flexion, and the knee is in full extension. So that's all. So now for the leg pattern in prone position. So the extension adduction. So position the patient in a prone position. I'll be behind or beside the patient. So the patient's hip is extended. I'm going to position the patient's hip in extension, abduction, internal rotation, and the foot is in dorsiflexion and inversion. So like this, with my proximal hand on the foot, and my distal hand is on the behind the on the hamstrings. So now I'm going to tell the patient to move his feet upwards. So the end position will be like this. So the hip is extended with adduction, external rotation. The knee is flexed over, and the foot is in plantar flexion with inversion. So for the next technique is the flexion adduction with knee extension. So in here, in this position, same position, patient is in prone, and I'll be behind the patient like this. So the patient is in prone with the knee flexed, hip is in extension with abduction, internal rotation, with the foot in plantar flexion and inversion. So like that, and then like this. So I'm going to tell the patient to straighten the leg and then move it outwards. So I'm going to apply resistance against the motion like this. This is the end position. The foot is in dorsiflexion with inversion. The hip is in full extension. The knee is in full extension. So the next pattern is the flexion abduction with knee flexion of the left leg, with the right hip flexed and foot on the floor. So in this position, the patient is in prone with the right leg on the ground, and the left leg is extended. So like this. This leg is on the ground, and this leg is extended. So I'm going to position the patient wherein the knee is in extension, hip is in flexion with abduction, internal rotation, with the foot into plantar flexion and reversion. So now I'm going to tell the patient to kick with your knee, and then I'm going to add resistance in that. So the end position is that the foot, the end position, so I'm going to hold the knee and the foot. So for the end position, the foot is in dorsiflexion with eversion, the knee is in flexion, and the hip is flexed with abduction and internal rotation.